We're proposing that $10 million of the $55 million be spread over the next 4 years to expand enrollment in the state's Nurse Family Partnership Program. This is a national model home visitation program for infants and toddlers in low-income households that has proven to show great results in education, in developmental milestones, and in staying out of the criminal justice system. We're proposing that $10 million of the funds be spread over the next 4 years to expand enrollment of low-income 3-year-olds and 4-year-olds in the state's pre-K programs to ensure that those kids get off to a good start in school. We're proposing that $10 million of the funds be used over 4 years to allow the state's 10 elementary schools with the highest percentage of children living in poverty, including this school that we're in today, to hire additional teachers and staff to work directly with those kids. Teachers, administrators, and parents at those schools would jointly develop the proposals for what type of staff would be hired, depending upon each school's unique needs. We're proposing that $10 million of the funds be used over 4 years to dramatically expand the state's competitive grant program for after-school and summer programs targeted at low-income youth. We're proposing that $10 million of the funds be used over 4 years to create a new competitive grant program to provide evidence-based reentry services to juveniles leaving Delaware's juvenile correctional facilities and returning to the community. Those children right now have an astonishing 80% recidivism rate. 80% of the kids who leave our correctional facilities are in the criminal justice system again within 3 years. We're proposing that $2 million of the funds be used to fund the first 4 years' operating costs of a recovery high school in Delaware for students who are receiving treatment for drug addiction. And finally, we're proposing that $2 million of the funds be used to implement the linked administrative data system that was recommended by the CDC for youth in the city of Wilmington.